In today's video, we shall be talking about kidney transplant. Hello everyone, my name is Dr. Hussein Baga. I'm a consultant physician and a kidney specialist working at the MP Shah Hospital in Nairobi. A kidney transplant entails removing one healthy kidney from a donor who might be a living donor or a deceased donor, and then implanting that kidney into you as a recipient. So a recipient is somebody who has end-stage kidney disease whereby the kidney function is not going to recover. So when a patient has reached end-stage kidney disease, it is recommended that he or she should be counseled about renal replacement therapy, because remember, the kidneys are very important organs. We normally have two kidneys which are located in the back here, and they perform various functions including removing of excess water from the body, removing toxins from the body, regulating your acid levels in the body, regulating your electrolytes like sodium, potassium, calcium and phosphorus among others, regulating your level of blood, which is the hemoglobin, by producing a hormone called erythropoietin, and also it helps in synthesizing vitamin D, which is very important for bone and muscle development. So when your kidneys have failed and you have reached end-stage kidney disease, then your doctor will counsel you on renal replacement therapy, which is either going to be dialysis, which we have talked about in our previous videos, or a kidney transplant. A kidney transplant is of course the preferred modality of treatment for patients with end-stage kidney disease. Remember, with dialysis, especially hemodialysis, you have to come to the hospital at least twice in a week, sometimes even thrice in a week. You have an access which is either a catheter or a fistula. It does entail that somebody has to come with you most of the time, so you have to have a caretaker with you. So all of this does have an impact on your quality of life. However, with a kidney transplant, once when the transplant is performed and you've recovered and you've been discharged from home, you only come for your regular clinic visits, and then subsequently you go home. So you can go back to working normally, you can go back to leading your normal life. Of course, you have to eat healthy, you have to exercise, you have to make sure that you don't take in any of those painkillers like brufen, diclofenac, what we call non-steroidal anti-inflammatory drugs which damage the kidneys, or herbal medicines. And you can lead a relatively normal life. So normally in Kenya, we only have the living donor program, meaning that we take a kidney from a healthy person who is preferably a relative or a spouse, and then we implant it in your abdominal cavity lower down. We normally do not remove your native kidneys unless if there's a medical indication to do so. Okay? So the surgery is performed simultaneously. So your donor and you as a recipient are both taken to theater at the same time. The kidney is retrieved from the donor and then subsequently implanted in you as a recipient. And then the donor normally stays in hospital for 3 or 4 days, while the recipient stays in the hospital for 7 to 8 days. Once when everything is okay, the donor is discharged after 3 to 4 days, and the recipient is normally discharged after 7 to 8 days if everything goes well. Once when the kidney starts functioning, you'll notice that you'll start passing very good amounts of urine, your toxin levels go down, your energy levels go up as well, and in a short while, within a few days, we tend to remove your excess, especially if it is a catheter. And then subsequently, we are also starting you on medications to protect the new kidney. Remember, the new kidney is a foreign tissue. So your body will start recognizing it as a foreign tissue and try to attack it using your immune response. So what we tend to do is to put you on medications to suppress your immunity so that your body does not reject the new kidney. And this is very important. It does not mean that once when you have been transplanted, you can stop the medications or the anti-rejection drugs. These medications are supposed to be taken every day without fail for the rest of your life so that you can protect the new kidney. Now remember, if you have diabetes or high blood pressure, which are the most common causes of end-stage kidney disease in Kenya as well as worldwide, you need to make sure that your blood sugars are controlled, you need to make sure that your blood pressures are controlled, otherwise they will damage the new kidney as well. A lot of restrictions are lifted once when you have a successful kidney transplant, like the amount of water you can take, like the amount of potassium-rich foods you can take. But remember, you still have to eat healthy. You have to eat a healthy, balanced diet, and that is very important. You also have to exercise regularly as well. You have to avoid medications that can damage the kidney, like your non-steroidal anti-inflammatory drugs, like Brufen, diclofenac. You have to avoid herbal medicine that are also dangerous to the kidney as well. Okay? And very important, you have to come for regular checkups to the hospital and see your consultant physician and nephrologist on a regular basis. The drugs that we take, some of them you have to monitor the levels, especially what are called tacrolimus levels, and your doctors are going to guide you on how frequently you monitor them and at what time do you have the blood test done. Another very important aspect about these medications is that they can interact with certain foods, which will prevent the absorption of these medicines into the body and give you a lower level than what is required. And that is very dangerous because that can make you reject the new kidney. Some of these foods include the grapefruit. The other one is pomegranate. Okay, so you have to be careful, and your doctor and your nutritionist will give you more information about these foods that can interact with your medications as well. There are other medications which you can take, like some antibiotics, some antifungals as well, which can also interact with your anti-rejection medication. So please don't take any medications without consulting your nephrologist. A lot of people believe that we do not do kidney transplants here in Kenya. I'm pleased to tell you that we've been doing kidney transplants for several decades. Here at MP Shah Hospital, we've been doing kidney transplants for the past 6 years, and all of them have been very successful kidney transplants. So we don't have to travel out of the country to do a kidney transplant. What happens to the donor? It is very important to know that the donor is going to be safe because of the extensive workup that we do. But after the transplant, the donor still has to be on follow-up with a kidney specialist. Even if it's once every 6 months, you need to do a test to make sure that the kidney function remains normal. And they need to make sure that they lead a healthy lifestyle. They need to avoid those toxins, what we talked about, your non-steroidal anti-inflammatory drugs and any herbal medicines. And they need to go for regular checkups so that their kidney that is remaining in the body remains healthy. I hope this video has been useful, and please share it and subscribe to our channel. And if you have any queries, we will be more than glad to answer them in the comment section. Thank you very much and have a lovely day.